Hello folks, I'm going to do a double tap. I'm James Legan from Great Falls, Montana, and I have a patient by the name of Martha here, and I'm going to introduce you to Martha. And she's just going to, this is going to be an informal discussion, and I think there's too much light here, so I'm going to just lower the shades. Perfect. So, we have Martha, and Martha, I'm going to give you the phone so you can kind of see what you look like. See how I
see.
Look? All right. So my plan is to interview Martha, informal discussion, and get her viewpoint of how what I call projected EHR, that's a large screen 24-inch TV with an HDMI cord, where what I'm doing on my Chromebook, 14-inch Chromebook with a keyboard, is mirrored so she can actually watch what I'm doing in the examination room at the visit, so she can actually, you know, gain some knowledge and it's a wonderful educational moment during the visit. So with Martha, she's been, thank you for joining, and my thought would be I'm going to go ahead and introduce Martha, and then as questions come in, I'll probably jot them down and get to them just so I don't disrupt Martha's delivery. So Martha, she can tell you a little bit more about herself, but she's a nurse, she's been in private business, she's now retired, and she's a patient of mine, and I'm just going to go ahead and give her the floor to talk about what her experience has been with this type of an approach in an internal medicine office. So, Martha, fire away.
I'll fire away. Well, as a nurse, there's certain huge advantages to this, and as in the role of a nurse, but as a patient, and that's what Dr. Legan asked me to talk about, I also find it just the plethora of information that is so available so quickly, and you can really chart your own health. And this also gives you a vested interest in making sure your record is just exactly right, and making sure that when you said it was left side and it isn't recorded as right side, they're just small details, but it helps you chart where you're at. And most of us are visual learners. I remember in the days when it was all paper chart, and there was the constant thumbing through, or the constant trying to get the nurse to find another paper that really didn't get filed in the right place, or the constant, well, we'll review that next time you come in. And this isn't necessary anymore. I can watch and
now,
see, wow.
I'm just going to interrupt you and see if we're getting video feed, and also can you hear just fine? If you can give me some hearts, if you can let me know if you can hear and see okay. Hi, Chuck. Good to see you. And can you see and hear okay, Chuck? I'd like to feedback just so we're able to communicate here effectively. Clear as a bell. Excellent. Thank you, Chuck. And I also wanted to thank Dr. David Grayson for actually giving me the opportunity to do this. I've been wanting to. Great. Thank you. Great. Glad you joined. But I just really thank David Grayson for giving me the opportunity and the courage to ask Martha to even do this, and very thankful for Martha for doing this. So sorry to interrupt, Martha, but carry on. Sorry.
Alrighty then. I think I like the charting part of it, where I can look and unfortunately have watched my weight climb perhaps, but see how my blood pressure overlaps with that, and it really gives me a visual of, well, as I gain another 10 pounds, my blood pressure is also impacted. But as I lose that 10 pounds, it's impacted again in a positive way. And I can see that with the overlays of this particular type of charting. I can also check dates, and I can look and see, oh, perhaps just pulling this off the top of my head, oh, I was gaining that weight and my blood pressure was going up because that was when my sister was so ill and I was trying to take care of her. And I can see how different things impact my health. And then I can also have a little more take charge of what's going on with my health. I've watched it, well, with my husband when he was diagnosed with diabetes, and he very courageously lost a lot of weight through diet and exercise because he just didn't want to have to go on medications. And we've seen a wonderful change, only because we could see the actual charting. If we came to the doctor and he said, well, last time your weight was thus and such, And then we hear flip, 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 flip as he goes through the chart. Oh, and before that it was, and then flip, 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 flip through the chart as he's turning pages. I can't remember those numbers, but I can look on this screen and go, aha, I see exactly what you're trying to tell me. I love that on these charts he can pull it up, and if I can see in real time what he is putting down about our visit. And sometimes we aren't as clear as patients about what we really want to say. But when we see it written down as the doctor has heard it, then we can say, no, that's really not what I meant. This is what was happening with me. Let me be clearer on that. And you can really be not in charge of your chart because it has to be factual, but you can be a partner in your chart. And I appreciate that. Like, I appreciate being able to go over my medications and say, oh, you know, I quit taking that vitamin, but I forgot to tell you. But now that I see it, I can say, I forgot. I remember now. I can look at my history. I can look at my family history. You can pull that up in a heartbeat, and we can review that. I just think it's essential to the partnership that needs to be maintained between a doctor and a patient. And sometimes as we grow older, it's a little harder to visualize that. And sometimes as we grow older, using the electronic equipment is a little intimidating. But to be there and be a part of it in the room as it's going on makes a huge difference. If he were just sitting there working on his computer, I would wonder how much of his time was really listening to me and how much of his time was simply working in his Chromebook. Whether it was about me or not, I still didn't have doctor's attention. But this way, we're both vested. We're both being a part of developing that chart, making that chart as accurate as possible. I also love knowing that if in an emergency situation, I find myself at the emergency room at the hospital, or I have to be hospitalized for some reason, he can access this chart from the hospital. I like that. I don't want to have to wait till he has to go back to the office and look through my paper chart, if he can find my paper chart at all. Because we all know, and if there's any nurses out there, you know how many hours are spent, how much time each day is spent waiting for medical records to get the medical chart to you, or if you can access those medical charts, is it in the medical records office? Is it in the doctor's office? Is it on your desk somewhere? Charts, for whatever reason, take legs and disappear. They just find places to hide, or they get misfiled. You never have to worry about that with this. It's always accessible at your fingertips. There's ways I can contact doctor on the weekend and so easily speak with him. Or if perhaps I need a medication refilled. I just pop on my computer at home on Saturday night and I send him a message, and on Monday morning, probably by 9 o'clock, my issue has been taken care of. My prescription has been renewed. Whereas before, it was call the doctor, leave a message with the nurse, have the nurse try to call me, but I'm at the grocery store now, so she can't reach me. So she has to leave a message for me, and I have to call her back, and it just gets to be a little bit nuts. But with this electronic system and the portal he set up, it's incredibly easy to be really invested in your own health care. And it's a partnership that we all have to be a part of, because if we're not, mistakes are made and things are missed. And I just think, I'm excited about this. I'm 71 years old, and I just think this is remarkable and wonderful, and I just get it. It's actually even more fun to come to the doctor now because you can see progress.
David Grayson just joined us, and Chuck wanted to let you know that you're doing an excellent job, and he's very appreciative that you're doing that. And he is Chuck's an expert on workflow, and he really appreciates what you're saying in terms of workflow in an office. David, while I have you on, I do want to thank you again. I don't think I would have necessarily done this until you nudged me a few weeks ago and asked me to interview a patient, and it gave me the courage to do this, and thankfully Martha responded, and she's just doing a great job here, and she's got a unique experience, not only being a former nurse, but also being in the business arena as well as being a patient. So I'm glad you joined. Kia ora, Martha. So that's New Zealand for hello, I believe.
Oh, hello.
And And I missed that. There was another point I think Chuck made, and I'm still learning this Periscope thing. So if I do miss any of your comments, I apologize. Does anyone have any questions, specific questions for Martha while I have her here for the next few minutes?
Well, and while we're waiting,
yeah,
addressing the business part, having come from a business background and being an office manager in a really busy office, time wasted looking for a piece of paper costs money. It's not effective, it's not productive, and it just certainly increases the stress level and the frustration in an office setting. This to me is such a unique setup to be able to save that money. And then the people, as nurses and doctors, the people that we are honored to serve really know that we are taking our time to serve them. Our time is not wasted on frivolous things like that shouldn't happen, because the record is right there, and it gives us more time with the patient. We're more invested in that one-on-one interaction that's so terribly important. Maybe the issue that the patient has to you isn't the worst issue you've ever seen, but to the patient, it is. If it's nothing more than an infected hangnail, to the patient, that's the most vital thing. And if we are not honoring those concerns with our full attention, and that can be done with this electronic method, we can give them our full attention because everything is at our fingertips.
Excellent, thank you. And David says too true. So he agrees completely with that. I think. Let's see, any other direction we want to go here? I think you've hit a lot of the main points that I was thinking of. So I do appreciate all of what you're saying. And I think for me, I view, and it's different from state to state and I think from country to country, but my own perception of the electronic record is that I'm just the caretaker. As the physician, I'm just the caretaker. This electronic record is, I think, the patient's. And what I can do to help out alleviate some fear and concern is to keep this record in a very organized fashion so it can be made sense of. And I can keep this information organized, well organized, so that when we do have time together, or when we're not together and still communicating either through the portal or telephone or whatever way we choose to communicate, that I can spend less time trying to find an old paper chart or this, that, or the other. It is nice to have that information well organized, and I really think I owe that to the patient, so that if Martha needs any records, we can get that to her instantaneously and take a lot of the effort off her part, really, because we can do that. And I find being able to do that can sometimes allay a lot of fear and concern. So I just think that's the responsibility of the physician. I think there are some excellent tools available that can actually make this happen.
Well, and I appreciate the fact that if I see the chart, and I see the graph, I love that. I love the graph and I love the overlay. Then I can say, could I have a printout of that? And I can take it home and I can put it on my refrigerator, or I can put it in my office, and I can refer to that and say, oh, look what I'm doing to myself because I'm gaining that weight, or I'm really allowing myself to be stressed. And I can. It's a visual thing is huge. Visuals are so huge. And he just brought up on here family history. So I can go through my family history or my social history. There are things we forget to tell the doctor. But if those little triggers are put up before us, an allergy, oh, wait a minute. I remember last time I took that medication, I itched all night long.
Could you repeat that question? I missed that. Sorry, Martha.
Yeah.
Somebody just asked. Could you repeat that? I apologize. I missed that. Okay.
But to look at those things, and it triggers... to look at your history, to look at your allergies, to look at your medications, it triggers something in the patient's mind, because even as a nurse, when I'm the patient, I don't really always have all my faculties about me. I am not the professional patient. I'm the professional nurse. And I just think these things help you and the doctor keep an accurate record for the optimal medical care.
Yeah, and I have to agree from my perspective. It's, a lot of the applications that I've been able to apply over the last several years I think I've tried to focus on what really makes sense and what can enhance the patient-doctor relationship, and focus on fine-tuning those to aid in that type of delivery. And I appreciate you commenting on that.
I think we have to realize, now speaking in the medical profession, and I was the executive director of the Montana LPN Association here in Montana for a few years, and have gone and had the wonderful opportunity to speak to practical nursing students and work with the RNs. Our product in medical care is service. That's our product. If we can offer, that's from a business point of view, but that's what we sell, is service. And if we can do that in the best possible, most efficient, accurate way, those that we are honored to serve are served in such a wonderful fashion.
And a couple of comments came in while you were talking. Okay. David said it really is great to focus in the moment so the doctor and patient can, I think he said, be together on the same page. I think he used something along those lines. And then I got another comment, and I didn't see from who, and it said perfect memory. Nobody has a perfect memory, and having this really helps, like you. So yeah, she's reiterating what you're saying.
Unfortunately, some patients, and we've all experienced that, and I probably have been one of those patients when I'm wearing that hat, but we really think that we're the only concern of the doctor. But doctors have many, many patients and you cannot expect one human being to remember everything about you, whether you come once a week or whether you come once a year. This brings it all together. It gets you both on the same page. You're responding in real time. You're correcting if corrections need to be made, and you're fully understanding and fully vested in that visit.
I think one thing that also that we can do is that with the knowledge base key, I can access up-to-date and wonderful information, up-to-date information, and print up handouts right at the visit. So I do a lot of that. And then the other nice thing is that I can do orders while I'm in with Martha. Say she needed a chest x-ray. While I'm in talking with her, it takes just a minimal amount of time, seconds, just to send an order out to my nurse so she can be working on it while we're spending time together. And then the other thing is that we can do prescription writing together. So whenever I say need to do a prescription while she's right here, I bring up the prescription writer, and all the drug interactions are right there so she can see. So if she has any questions, we can go over any contraindications and such. So we can, if I write a new prescription, we can go over the interactions, and if there are any concerns, we can then focus on that in real time as well. So those are some of the other additional things that can be done at the visit with this type of an application.
Well, and that brings up another point. When I was actively nursing, the doctor would need to order perhaps an MRI or an X-ray, as Dr. Wiegand mentioned. Would mean he'd have to leave the room, find the nurse, or leave the nurse a note, and hope there's another time when that service with that person there we are honored to serve, another time when that is interrupted, and when you interrupt that, you change the entire spirit of the visit. And so by him being able to just send that to the nurse, and then she picks it up if she's seeing another patient, she also can get right back to her desk, take care of it. When I walk out of this room, I know my prescription has been sent to the pharmacy, I know that my order is ready for my x-ray, and I know that we are all on the same page, and I'm getting the optimal care, the optimal service that I deserve.
And I'm a little maybe different in what I expect from my nurse, and we've changed over time. I'm doing some things that I never used to do when I did the paper charting. I do all my own medication reconciliation, do that at the face-to-face time because it's better use of my time, and then I can print up the medication list either to paper or to the portal or both right in real time to make sure that we have everything right. But what I've done is I've changed the nursing role a little bit with some of the electronic applications. With my nurse, she has a dual monitor desktop, and on that dual monitor desktop, on the left hand, she has the electronic record. On the right hand, the health CRM, I call it, customer relation management application, and that's where all the portal messages, secure portal messages, funnel in or out of the office. All the e-faxes, electronic faxes, in and out of the office. So it's our communication line in and out of the office to other offices, to hospitals, elsewhere. And do all patients like it, or some refuse? There are some patients that may not necessarily like the projected EHR, and I don't do it, but I've got the option to utilize it. But I would say, and what surprised me, I thought it would be the younger generation, the kids in their 30s, 20s, and 30s that would gravitate towards this. I would say they're probably less inclined to be interested because they're simple. A lot of times they're not complex. And paradoxically, what I found, and I didn't think it would be true, when I started doing this a year and a half ago, I thought it would be the elderly, complex Medicare patient that would turn me off. In fact, it's been opposite. Those are the ones that really, I think, time in my time. So it really does. It really has worked out in an internal medicine office like this. So thank you for that. So I think we probably hit most points. Anything else you'd like to comment on, Martha?
Again, from the nursing point of view, I think it's wonderful. It takes a little education, but bottom line, any more nursing students have learned a lot on the computer. It's not a foreign country to them as it was to me. From a patient point of view, it's perfect. I think it answers so many questions, and I really feel as though my concerns are being met as a patient, and we're working together. This is a huge partnership, and we're working together. From a business perspective, I just think it's solid. It saves a lot of time, and when you're saving time and you're getting your patients there on time, your patients are more willing to come, not show up a half hour early hoping maybe they'll get in early, or coming a half hour late because, oh, doctor's always behind. This also keeps everybody on track, and again, time and business is huge.
Thank you, Martha. I'm going to click here, and, well, let's just do it this way. I'm still learning here. Let me see. Double click. Oh, let's see. I was going to try to show it on myself, but here, you can film me. All right, so once again, I wanted to really thank Martha for the great job that she did. This to me is, I'm not, my main mission here is just to exchange ideas, give a different perspective. I know this approach isn't for everybody, but if you can see, a part of this approach that may work for you, I'm just trying to pass along what I've learned over the last year and a half, some hard lessons learned along the way, and just as giving back to the profession. I just want to share with whoever may use it. And one really important point is make sure you discuss this with your local IT. If you do start anything, I'm not trying to tell you how to set everything up. You need your specialist to help you and make sure everything's secure, HIPAA compliant, and all that. So, but if you do see something during this interview that you might like to try or think about, that's the whole point here, is that I'm just trying to exchange some ideas and hopefully we can all help each other out in these tough times. So thank you, Martha. It's been wonderful. You're just a wonderful gal, and I appreciate you doing this. So
You're very welcome.
all right. Well, I'm going to attempt to end the broadcast here. Any further questions before I do? Go ahead and give us a question or two. If not, you can tweet me out. I've got a Twitter site, and I've got over 150 blogs on that Twitter site, so you can click on my name, Jimmy_Vanagon, and there's I've got about over 150 blogs through WordPress, and tweet me or direct message me if you have any questions. And thank you all again. Appreciate your time.